POCSO, I will talk about the dust that is not yet settled about POCSO among all the stakeholders, that is doctors, that is medical field, judiciary, police station, and our patients or the common people. So we all know what is POCSO. It's a Protection of Children from Sexual Offences Act 2012, and 90% of children experience some form of sexual abuse or harassment. So it's a very important thing to know about POCSO, and more than that, why gynecologist or even pediatrician or any doctor should know about POCSO. First thing is, we are the first point of contact for as caregivers. It's our social and moral responsibility. Beyond the medico-legal part, we should not forget that we have taken the Hippocratic oath. So, and most important now, the medico-legal thing is the reporting is mandatory and not voluntary. The word mandatory, I think it will change the attention span of everyone, and it will bring to next 12 to 13 minutes that I have. So failure to report, if you know about any case of child abuse or harassment or in any form of child pornography, I'll talk in the presentation, and if you don't report it, it is punishable with an imprisonment up to 2 years. For common people, it is up to 6 months with fine or both. So mandatory reporting brings many challenges. So what are the challenges? First, knowing what comes under POCSO. So the Act defines various forms of sexual offences against children, including penetrative, non-penetrative acts, sexual harassment, and most important, child pornography. Age. Sometimes among gynecologists, pediatricians, there is a lot of confusion about age. So till the commencement, till the 19th birthday, to be more precise, 18th year also comes under. Up to 18 years means the 19th birthday of the child. So this is very important. You may get the case on the 19th birthday. So even that comes under POCSO. From the next day, it's not under POCSO. Also, the Act talks about protection, rehabilitation and support services like counseling, medical services, and educational assistance. Most confusing scenario for gynecologists: marriage with consent. In many communities, even the marriage less than 18 years still continues in the community. We see a lot of cases of child marriages. Child marriage and POCSO are two grey zones, as I said, where the dust is not yet settled. Comes as primi gravida for diagnosis of pregnancy or USG. One more scenario is female below 18 years comes for a MTP or for consultation, wherein parents or family is a known patient to you, known to you, a VIP, or with a lot of social contacts. So let us see what are the common scenarios. Child sexual abuse. It is involvement of child in any sexual activity that she or he does not comprehend, is unable to give, this is WHO definition, unable to give informed consent, or for which the child is developmentally yet not prepared. For all practical purposes, if the child feels that it is inappropriate, सपोज म्हणजे मराठीत सांगायचं तर घरी मामा काका आले आणि त्यांनी गालगुच्चा पकडला, जवळ घेतलं, and the child feels that it is inappropriate, it is a child abuse. Meaning, so inappropriate for the child. Red flag signs, common presentations in OPDs for which we should be alert. Change in way of sitting, change in gait, bruises on arm. We pediatrician get these cases regularly, and rural, urban, no, meaning all places it's the same. Bruises on arm, shoulder, back, buttocks. Ruptured tympanic membrane, repeated hospitalization, functional complaints, functional headaches, functional abdominal pain, bleeding from genitals, emotional complaints like reluctance to take part in gatherings, change in biological functions like sleep, appetite, bowel, bladder, mood swings, displaying sexual knowledge, disappropriate to the age 6. See, the take home message is, whenever you get such patients and you are in your busy OPD, please don't neglect these cases. And if you are busy, you may call the child for a special consultation, sit with the child with a female assistant with you, male assistant with you, tell the parents to wait, give enough time to the child, confide the child to tell that it will not be disclosed, and that then the child will definitely, I have seen almost 3 to 4 cases in a place like Vaizapur in last almost 10 years. So child pornography involving images, videos and other visuals of children engaged in sexual activity or poses even naked images of children. About pediatricians, gynecologists, we put it casually, operated case of hernia. One of our friend Dr. Hemant Joshi from Archana Joshi from Virar, their YouTube channel was blocked because they had shown some case related to pediatrics and the child was naked and they got a notice that you may be sacked under POCSO. So don't be casual while sharing images of children right from age 1. So challenge to whom to report. I think this is the central part of my presentation. The first authority that you are supposed to report is first local police station. Also, we have a special juvenile police unit at district level. Now, all the offences under POCSO are cognizable, and under section 154 of CPC, FIR must be registered. But what is a common thing is, you go to the police station, as I said, but they don't want these extra investigations or things. So the first thing is they will neglect, they will make the person to sit there for 1 hour, 2 hours, 3 hours. They will call you, Sahib kashala, rahu dya na, hot ast, such. These are the remarks that even we have heard at our place. So then what? Because see, being more than safe medico-legally, we might even, it's bad that we should not land in medico-legal trouble, but remember that we have taken a Hippocratic oath and we can't neglect this thing, and it is a question of a child who can't resist such things. So first thing is, you should call on 100 number. You should tell the details of the case. You record the call on a separate recorder if you are using an Apple phone, or many phones have recorded a recorder in phones other than Apple. So and every 100 call gets recorded. So you put on the paper that you called at 2:42 p.m. on 100 number and store the record as just now sir said. So, and as I said, I feel bad to tell that to be safe. See, it's not the question of your safety. Okay, you can, even if you make mistakes, you should not make, you can fight the case, but it's the matter of a child's life. And just imagine that if the child is from your own family. So when I say being safe, it also means about the child. Send a mail on mail ID of SP, CP of your jurisdiction. Additionally, if you want again support, I will give the extra number of the individuals also. So you can call Childline helpline on 1098 number. Even all the calls are recorded. I am associated with Childline and it is very active. You will get immediate help. As meaning we have displayed these numbers in our OPD of our SP. If you are sending a mail and it is in trash or it has gone in spam, so call on this number of SP office. Again record that call and tell them that the police station is refusing to take the complaint. We have sent a mail. Please reply to this mail. Even if you are not getting reply, get the direct mobile number. The mobile numbers of all the CPs, SPs are available. Send them a personal message on them. Record the call that reply to the mail. So invariably they have to reply. Now, repeated failures to receive complaints at police station. I think here comes the role of associations. Our associations are not just meant to, we are not just meant to meet in conferences. We should also, or arrange conferences, meet, go, call the CP to your association, have a session. I must say that call CP of your area, your district for every conference and tell them the problems about POCSO, because they are answerable about this. Arrange a workshop for a police station at your taluka or district and tell them that if we come for a complaint and you don't register the complaint, these are the consequences against you. And I think we should do this. If you don't get any response from anyone, you are not, direct message to the DGP, Director General of Police of the state. Their mobile numbers are available. Even if now Rashmi Shukla madam is there, message her, call her and tell her that madam, this is happening and you are responsible, and they have to respond. And what is my observation, the officers at the upper pyramid, they are more sensitive and they will immediately respond. And it is your work, it is their work, meaning त्यांना घाबरण्याची काही गरज नाहीये, त्यांचं आणि आपलं दोघांचंही कर्तव्य आहे. So her mail ID is also there. I think if there are repeated lapses, we should seriously meet the Home Minister of the state. We should represent him. We should also send, meaning I would go to the extent that send a message, direct message to Devendra Fadnavis about every case of child abuse. Why not? त्यांचं कामच काय आहे? काय म्हणजे घाबरायचं काय काम नाही, हेच काम आहे त्यांचं. आपल्यालाच वाटतं की कसं करू. So you send the details, and I think every system failure in POCSO should be reported. Whether consent should be taken, so yes, definitely consent should be taken, at least assent should be taken, meaning होकार तरी त्या मुलाचा घ्यावा घेण्याची पद्धत आहे. So this is a 7-step process for mandatory reporting. So first priority is mental health and well-being of the child. Second, providing children with information about POCSO. Then elicit and respond to child's fear and worries about reporting. Negotiate with the child. Explain the legal process that will follow after the reporting. Explain how confidentiality will work in case of reporting. Obtain the child's consent or assent. See, although the act says that the consent, like in MLC or in PM, for Rajiv Gandhi's PM, the consent of Sonia Gandhi or Rahul Gandhi was not taken, or it's not required, it's mandatory. Or for sending a medical legal case, we should not look for consent. But in this case, if the protocol says that if we don't take consent, if we don't follow the 7-step process for mandatory reporting, the outcome of the case, the rate of conviction becomes less and less, the less you negotiate with the child and the parent. So I think taking consent is a part, and we should do it. The format to report to the police station, report on the mail, I think Amit sir will, if he gives me the number of all the delegates, I will see to it that the format is sent on the WhatsApp number of every delegate. So let's not waste time on that. It's available with me. Ethical dilemmas. Patient is known to the doctor. Fear of harassment by non-consenting families. That has happened with one of our friend who is sitting here. He told me before the talk. Harassment by police and pressure on the doctor to back out. By indirect pressure of the family on the police, explaining the parents that who reported, the parents will ask koni sangitla, no, nothing doing. Tell them, show them the act very politely and firmly, and tell them that not just you, I will also land in trouble. And most important, it is the safety, it is the question of safety of your child. So politely, I think we should not run away from this responsibility, and it will take time for the people to understand. MLC ला पण आपल्यावरती प्रेशर येतं एकेकाळी होत होतं हे सगळं, पण आता लोकांना कळून गेलं की नाही हे करावं लागतं. पीएमच्या बाबतीतही मोठमोठ्या लोकांचे फोन येतात सगळे, पण नाही ते करावंच लागतं. सर इज हिअर, आय थिंक ही कॅन एनलाइटन समटाइम us, and we can't run away from this. Tell this to the parents, tell this to the police too, and tell to all the stakeholders. Pitfalls: writing wrong age. Yeah, I'll complete it in time. Writing wrong age, meaning many a times it happens that the child comes and the doctors write the wrong age. Please don't do this, because it has happened that in consenting marriages there was a divorce. I know this case. There was a divorce, and afterwards the parents and the female registered a POCSO case, and the doctor had written a wrong age. He had not reported. He landed in trouble. Rejecting or referring the case, no need. Don't refer the case to your rival, because everything is manageable if you follow the law. Lastly, if I think I have almost 2 minutes. As I said, some frequently asked questions that if is it necessary to take the consent? Yes, I have answered. If the child wants to report the case, but the parents or guardians of the child are unwilling, it can happen. So in this case, I think Childline, Child Welfare Committee, I take help of Yamini Abde madam. You can take her number. She is the Anjali Damania of child rights, and she will help you even in the midnight 2 o'clock. You call her, she will respond, and she goes to the extent of coming to the place. So Yamini is a leading child activist. You can take her number, and if in case the child wants protection in any way, the police has to give protection even to the child, and this has happened if we take action, if we are proactive enough, not just reactive, proactive enough. So, and I think again, why not our associations, our presidents step in such cases? If the doctor is harassed, or even if the child is harassed, I think we all should go to the police station and talk to them that we are not going to take this shit, we are not going to take this nonsense, and we will sack you too. And see, when you take the stand, the police or the judiciary or all the stakeholders are waiting for you to take the stand on POCSO. I think some FAQs, just one slide of FAQ is there, but I won't cross the time because Amit is my very good friend, so I won't harass him more by extending the session. If you have any queries, this is my mobile number, these are my handles, my mail ID, and even this talk will be available afterwards on YouTube. So please feel free to ask me any questions, or you want any formats, please message or call on this number. Thank you very much.